Welcome once again to Breakfast Central. Now, today marks World Bloodless Surgery Day, and the Bloodless Medicine and Surgery Society, BMSS, an international multidisciplinary society of experts in blood transfusion avoidance, is hosting Bloodless Medicine and Surgery Week. Now, with the theme Bloodless Care in Emergencies for Better Outcomes, BMSS is aiming to raise awareness about bloodless medicine and surgery among clinicians and the public.
They say that many doctors have been advocating for bloodless surgery based on research that shows that bloodless surgery bears a reduced risk of complications, while blood transfusions can increase the risk of complications such as infections, allergic reactions, and blood clots. We're now joined by the President, Bloodless Medicine and Surgery Society, BMSS, and the Chief Consultant General Surgeon in the University of Calabar Teaching Hospital in Nigeria. He's a Fellow of the West African College of Surgeons and a Fellow of the International College of Surgeons. We welcome Dr. Nathaniel Usoro as he joins us. Good morning, and thank you very much for joining us.
Thank you for inviting me, Osa and Olive. I'm happy to be with you.
We're happy to have you as well. Now, talking about bloodless surgery, I know that if we bring this back home, not just in Nigeria really, for those, there's certain people who do not believe in, the surgeries that require blood transfusion. There are certain people that would totally frown against it. For example, we know those whose faith is the Jehovah's Witness. They would not do bloodless surgery. But now we're starting to see that there are scientific reasons why this might be a good idea. So I'd like you to give us insight into how bloodless medicine and surgery can be an effective alternative to traditional medical procedures that involve blood transfusions.
Thank you. You started in the right place. That is to say, with patient autonomy, because that is where modern bloodless surgery started, an attempt to practice ethical surgery in respecting patients' wishes. And as you rightly said, there are individuals who would decline blood transfusion, and therefore some medical practitioners try to accommodate these ones. A foremost individual in this regard is Dr. Denton Cooley, a cardiac surgeon in the US, who is widely regarded as the father of modern bloodless surgery. And in 1962, he performed the very first bloodless open heart surgery. Now, that may not sound so remarkable today, but at that time, it was thought that it's not possible to do open heart surgery without transfusing 20, 30 units of blood. But he figured out how to do it, and he did it successfully, and it was on a Jehovah's Witness. The remarkable thing is that subsequently, it turned out that the patients he did were having a better outcome. And so by the time he did like 500 cases, he was able to compare and published in the 70s that this is actually a superior form of surgery. And he went on to become the chairman of the Texas Heart Foundation until his demise about 7 years ago. So the day he did that first bloodless open heart surgery was May 16, 1962. That is why we observe that day as a World Bloodless Surgery Day. And like I said, as time went on, it turned out that it wasn't really substandard surgery. Rather, it was quality surgery. It was a superior form of care. And with the advent of new pathogens and even the older ones, medical scientists began to get interested in how to avoid blood transfusion. But the key issue now has to do with outcomes, because it is found that blood transfusion doesn't really do what we thought it does. We all used to tell our patients that we want to improve the tissue oxygenation. Well, current evidence is that blood transfusion actually brings down the tissue oxygenation. Or we say we want to stop hemorrhage. Current evidence is that transfused patients bleed more, and immunomodulation problems that make patients stay longer in hospital or get more sick, that is more morbidity, and even to die, more mortality. So there's been a lot of evidence now that we are into evidence-based medicine, which is what now moved the World Health Organization to tell all doctors to move away from blood transfusion. and our society, Bloodless Medicine and Surgery Society, as well as the Society for Advancement of Blood Management. These are international societies. They are, I could say, at the forefront in trying to get the world to move away from blood transfusion.
Dr. Sor, it might still be a little confusing for anyone who's hearing about medical surgery and then saying and then bloodless right next to it. It wouldn't make a lot of sense. So can you help us understand better what a bloodless surgery procedure is like, and how do you conduct surgery without blood for the layman to understand?
Thank you. Maybe I should start from what it is not. So bloodless surgery is not that not a drop of blood is seen during surgery. That's not it. Though it does involve minimizing blood loss. Sometimes it is greatly minimized so that what is lost is negligible. However, when we say bloodless surgery, we're saying providing quality surgical care without the use of allogenic blood. That means donor blood, without blood from another individual, and with the aims of improving the outcomes, as well as protecting the patient's rights. So we're not going to do substandard surgery. Our outcomes have to be better. And we are also concerned about patients' rights, because not only Jehovah's Witnesses, there are lots of individuals who do not want to have a blood transfusion. And unfortunately, some of these individuals have to check into hospital and pretend to be Jehovah's Witnesses when they're not, because they don't want a blood transfusion. But this is taking account of that. And the key thing to understand is that blood transfusion does not do what we thought it did. So we now move on from there and improve on it by adding lots of techniques that can, one, increase the blood level, that is to say, optimize the patient's hematocrit, and two, lots of techniques that can actually minimize blood loss in maybe surgeries that, let's say like open heart surgery, that ordinarily one would have lost a lot. You can imagine using techniques that would minimize that loss to maybe less than 100 mils, 50 mils for open heart surgery. So the third one is to optimize tissue oxygenation, because one key thing that blood does is to supply oxygen to the tissue. And blood transfusion opposes that. It actually brings down tissue oxygenation, which is what many do not know. So we, on the other hand, do some things, including actually administering oxygen to our patients to optimize the tissue oxygenation. And number 4 pillar is that we support the patient's anemia. If a patient does have anemia, we support the system to recover from it without blood transfusion by various techniques. So in the case of surgery, these things that we do span through the continuum of surgery. That is from the preoperative to the intraoperative to postoperative. Right from the first time that we see a patient, we're going to find out, like, is the patient on some medication that will increase the bleeding? If so, we're going to stop it. Are there some other problems of the patient that can cause more bleeding at surgery? We stop it. And we're going to prepare the patient well, try and make sure that the blood level is high enough. So we have things we can use. We have iron preparation. If we want to raise the hemoglobin fast, we can use intravenous iron instead of oral. And we can even add erythropoietin to speed things up. So now patient is coming for surgery. We're not grouping and cross-matching 4 units of blood and all that. No, we're going to use the medication that the World Health Organization is telling us to use. That is tranexamic acid. We can add vitamin K, which many clinicians may not know that it has an effect on acute hemorrhage, not just for liver issues. So we have lots of other medications that we can use, but those are the 2 that are commonly, nobody would say they cannot find those medications around. We position our patient right. Okay,
Dr. Soro, you've highlighted so many brilliant points as to, how these bloodless surgery has immense benefits for humans. You've talked about ways to go around it, especially, with tissue oxygenation and the likes. But I'm certain, I want to believe that there are some risks involved in bloodless medicine surgery. So I'd like you to share what the risks are.
So this is something that has been very difficult to identify. I can tell you, if you go, you can do a search in scientific literature for the problems or risk and hazards of bloodless medicine. You might not find a single paper on it. That is actually very strange. For instance, using tranexamic acid, there are lots of imaginary, that is hypothetical risks. But in reality, that is when it's actually checked that have patients suffered this, you can't really find. So a lot of the techniques, I only touched the tip of the iceberg maybe for lack of time. But the World Health Organization describes these techniques as safer than blood transfusion. And that is in a manual on clinical use of blood by the World Health Organization. So I cannot immediately tell you, okay, these are problems of bloodless medicine, because I cannot scientifically bring them out. Most of the techniques, virtually all the techniques in bloodless medicine are salutary to the patient's health. They're not going to cause immunomodulation because you're not transfusing. They're not going to cause hypoxia because you're using fluids that actually reduce the blood viscosity, and then you're giving oxygen. They're not going to increase hemorrhage because you're using things that counter bleeding and so on and so forth. So let me just stop there and then take some more questions.
The WHO, has of course directed health institutions to embrace bloodless medicine and surgery process. This, of course, I believe you would say is a welcome development in Africa and African countries. But I want to talk about Nigeria. Are there certain medical equipment or medical facilities that maybe are necessary to be present in order to have a successful bloodless surgery? And do you think that the country currently has these things in place, and maybe also other parts of the continent?
So in bloodless medicine all over the world, we emphasize education rather than technology. It's true that technology has contributed a lot to bloodless medicine, and bloodless medicine has also contributed to technology, giving ideas on how to develop things. But whatever you're doing now, whatever you're able to do now with blood transfusion, the fact is that you can do it better with the same facilities without blood transfusion. So yes, we can use technology to reduce hemorrhage. Electrosurgical instruments are available, diathermy and more complicated ones may be available. But if already you're doing surgery without them, you can actually get a better outcome, even still in that setting. If you master the simple techniques of bloodless surgery, if you're doing open heart surgery, liver resections and so on, adding a cell saver or something to recycle the patient's blood so that the patient's blood is not lost. Adding that is just adding a little more equipment, and it's standard now, basically for all facilities that do those things, transplants and so on. They basically have cell savers. So if one wants to practice bloodless surgery, the question is, what is the setting? So whatever is standard for that setting would be adequate.
Yeah.
All right. Dr. Nathaniel Lusora, thank you very much for your time this morning. Very quickly, in like maybe 30 seconds, I have a different conversation. I just wanted to hear your thoughts. There's a strike. The resident doctors are beginning a warning strike. You're a doctor in Nigeria. What are your thoughts about this?
Well, it's very painful for any doctor, any committed doctor, to think about going on strike, because you don't want patients to suffer. And I can tell you that even if the resident doctors are going on strike, it's very likely that they'll be sneaking around to check on their patients. So I think it's important to identify what are the issues, what are they striking about? Is it valid? And if it is, there's no point, putting off. It's better to address them promptly out of proper regard for the patients. And of course, even for the doctors, because they do deserve to be treated well.
All right, Dr. Nathaniel Lusora, thank you so much for your time once again. We would love to speak with you again. Have a very wonderful Tuesday ahead.
Thank you, also, and all of you too.